Hi, I'm Gary White for Channel 6, Central Kentucky Television, here at Isaacs and Isaacs General Dentistry. I'm here with Dr. Isaacs, who we get to see each month, telling us all about dental care. And we have two other ladies who are here with us as well, right?
Yes, we have Sam Tingle. That's Sam. That's one of our hygienists here at John Isaacs Dentistry. And we have her daughter, Elliot Tingle. Wave, Elliot. There you go. And Elliot has been so gracious to come in, and she's going to sit in as a model patient today. Now, she has several procedures done on her in the past, but today we're not going to do any procedures. This is kind of a mock-up. We're going to kind of show what we do when we have a child here and how we go through it. As I was saying earlier, we try not to intimidate a kid. We try to make it kind of playful, fun, especially if it's our first time. We don't do any treatment. Sometimes we just give them a chair ride. Sometimes on a 4-year-old, we might just bring them up in a chair. So I get a lot of questions. When is the best time to bring a child in for an exam? Anytime before the age of 4, especially if there's no problem. We don't want any problems at first. We want if mom's having a cleaning done, come on in with mom or dad and just do a chair ride, maybe when they're 2 or 3, something like that. But at age 4, we kind of like to do a little better exam and start the cleaning process at that time. So today we're going to go ahead and the first thing I always do before I look at any patient is always look at the chart. As the girls know, it's kind of my pet peeve. I won't walk into a room without looking at a chart first. If I do, I generally back out and I come, where's the chart? So it's just something, it's a good habit for any practitioner to get in and don't look at a patient without looking at the chart. You want to know if there's any medical problems, what we did last time, and what we need to do today, so there's no confusion.
Absolutely.
And then after we look at the chart, I always look at the x-rays before I look in there. If they took any x-rays today, I want to see the x-rays that we took on this particular day. And if we didn't take any today, I want to see what we took last time. I want to make sure we didn't miss anything. Make sure that there's a Panorex in the record. Just certain little things like that. So that's what we do. So Sam, go ahead and treat Elliot like you would. And what she's doing is just doing a general exam. She's looking inside there. First, she's going to make sure that the child is not alarmed in any way. Of course, this is her daughter, so she's very relaxed. Make sure she doesn't see any frank infection. Make sure there's no decay. Make sure there's no pus. A lot of kids come in here, if we haven't seen them before, there'll actually be some drainage coming through there, and we can see it, and we'll treat that with antibiotics.
Okay. So we were talking, 4 years old kind of is the first time. When do kids' teeth actually start coming through?
Well, at about the age of 6 months is when the lower incisors will start coming through the gums. So you kind of look at it at 6 months, and it can be a month or two before that. It could be a month or two after that. But if it's longer, don't be concerned. I've never seen a kid yet that didn't have something coming through there at some particular time. So you look at about 6 months.
And when do they get their full mouth of kids' teeth?
Okay, at age 2. The 2-year molars will come in approximately age 2. Females a little bit ahead of the males. The males are a little delayed. If you look at it, males are taller. It just takes longer for us to kind of grow up. So we just grow not faster. We just grow a little bit longer. So that's generally what it is.
Okay. And then, so we have their teeth coming in around 2 years old. 4 is a good time for them to actually start getting their teeth checked out. But all those teeth are eventually going to switch over, right?
Yeah, right. You have baby teeth or deciduous teeth from age 6 months to 2. They're coming in, and then you'll start losing those teeth at about age 5 to 6 or 7. You'll start losing the first 2 that came in are generally the first 2 that will leave. It'll be the lower incisors, those front little teeth. They'll get a little loose. Very common. Somebody will bring them in, and the teeth will maybe wiggled out. That's how we say it. We never say extraction in front of a kid. We always say wiggle out. There's certain,
because they like those wiggles.
Certain little words. We try never to say the word blood. We say hemorrhage. We never say, that high pitched this thing.
Those instruments.
Those instruments, yeah. This thing. Go ahead and hit it, Sam. Hit it. That thing. Everybody calls that a drill. We never say the word drill. We call it a handpiece. I know it's kind of a silly word, but it's a handpiece. And that the suction. we can use a name for that, like a euphemism for that. Mr. Thirsty is what she calls it. Suction. I call it a spit sucker. I just say get the spit sucker.
A lot of times Dr. Johnny will squirt on. He likes to play around.
Yeah, sometimes we have fun. You got to watch this. Sometimes these things stick, and then you really messed up the whole exam. But yeah, so we have several things that can be very intimidating, and we have the these instruments that are called explorers. It's a metal toothpick, and that's what we do. We kind of pick around on there. We never say that word either, and those things are kind of intimidating too because they're sharp. But we just kind of gently get in there, and that's how we detect tooth decay and gum disease with those instruments. And Sam that's what she's doing now. So I'm going to stand up here and kind of look over this thing, and then so whenever we're doing the exam, I've already looked at the chart. Now we can see, and she did pull up. These are Elliot's X-rays, so we can see the X-rays. And Elliot, she's had all these restored. She had several spots of decay that we have fixed. We've already done all that, right? Okay. So we haven't taken any follow-up X-rays on it. Probably don't need to. On primary teeth, sometimes you can kind of see through it. You can almost see through these teeth sometimes without taking an X-ray on it. So that's what we do. But we do have them here. So if you go ahead and Sam, if you want to look at Elliot's teeth, go ahead. Elliot, lay back. She's doing now. She's going around. When I look in there, I always kind of count the teeth to make sure that Elliot should have 20 teeth. She should have 10 up top and 10 down below. So that's kind of easy. A lot of times we've been doing this so long, you don't have to look. You don't have to count. You just know that they're all there by the tooth structure. And if a kid's kind of nervous, we'll count out loud to them. Just let them know what we're doing. Of course, she's doing fine. How many teeth she got?
Well, she's missing a few.
How'd that happen? We had to wiggle out some?
We had to wiggle out some on her. Even though she's a hygienist child, she's prone to cavities.
My kids had them too, and of course my dad is a dentist also, and I can remember bringing my kids down. I did it on a Sunday so that I could kind of hide from Dad, so he wouldn't know that my kids had cavities, and he came in and caught me. So anyway, that was so it does happen to us too.
Yes.
Nothing to be ashamed of. It's just part of our culture. We have a tendency to eat between meals here in the United States, and that's what does it. The sugar, all our sugar intake is what does that.
So also for kids, when should they start brushing and flossing and all that kind of stuff?
You want to, as soon as the teeth come in, you want to start brushing them. Even at 6 months, you don't have to use a toothbrush, but you can get a washcloth. You know, a lot of kids like to, if they're teething, they kind of like to have something in there. It doesn't hurt at all to get in there and kind of swab it a little bit with a washcloth, just a wet, warm washcloth. No soap, nothing, just kind of wash it off. If you can get your finger in there, kind of scrub on it. And then as soon as a kid has the manual dexterity to use a toothbrush, go ahead and let them play with it. A lot of them like to chew on it, so get them used to that. So I would say certainly about age 4 they can be doing it on their own. Before that, make sure that you do it before they go to bed. The best time to brush is before you go to bed, because when you're sleeping, our mouths don't produce saliva. So that's it, and because it's dry, and if you've eaten something, that sugar will turn to decay very fast, as Elliot has shown us.
Now, how about flossing?
The hygienists are going to tell kids to floss. I don't, and the reason is, if you can get a kid to brush, you're doing pretty good. So I don't worry about it. Children don't get gum disease. They don't get periodontal disease or something called, on some kids that are diabetic may, but they don't get any kind of gum disease. So it's great if you can. To me, it's just a little bit of overkill. Now, I'm sure the ADA, the American Dental Association, is going to say, "What am I doing? Telling kids not to floss?" I think it overwhelms them, and sometimes it hurts, and then they might get a little bleeding out of there, and that's now they're not going to brush. Is what you wanted to do anyway. It's all bacteria. You want to get the numbers down. But if they certainly had a problem with tartar, which a lot of kids don't, if they do, it's generally they have a kidney disease that causes it. And we've seen some kids that are Elliot's age, and they do have a lot of tartar. That means it's not being eliminated through the kidneys, so then we'll refer them to her MD, and they'll figure out what's going on with that.
Now, you said there's 20 teeth for the child's mouth. For an adult, how many are there?
32. So you have your 20 teeth and they're replaced with 32. So you're saying how they get in there? Well, the mouth grows. It'll almost double in size. So when you're little bitty, like Elliot, of course, our heads grow a little bit at a time, and they'll get in there. So, and if they can't, usually when we say 32, we're counting the wisdom teeth too. So, a full complement of teeth would be 28 because generally we don't even count the wisdom teeth. Some people keep them, but it's fairly rare.
And then also, what is the biggest issue for kids with getting cavities? What causes that the most? Is it soda? Is it candy? Is it just not brushing with?
Any refined sugar. It's between meals especially. And why between meals? Because if we don't brush, the only time you're going to brush is after a meal. You're not going to carry around your toothbrush and get it whenever Grandma gives you a cookie. You're not going to do it. So all that it's the sugar that we're eating. And I've told people, I've told you before, you could have you could eat a whole cup of sugar at one sitting and it wouldn't bother your teeth. But you could take a little thimble and about every 10 minutes dip your finger in it and just do that. It's going to destroy them over time. So you see that quite a bit. And we see a lot of 20-year-olds that have just ruined their teeth as teenagers. They say, well, I don't do that anymore. Well, you did it when you were 16, 17, 18, and all those little pits and fissures, they got microscopic crevices in their teeth, and it caused the decay. So the damage was done. They're not doing it anymore, but you can't do anything much about it. Certainly get in here. But I saw an adult, and I saw a 20-year-old today that needs to have all his teeth taken out, every one of them. So it does happen right here in Springfield.
And you also, another thing with kids sometimes are braces. When is that kind of time frame wise?
Generally, you're looking at about the age of 12 when all the permanent teeth are starting to come in. On females, you want to catch them a little bit earlier than the guys. Guys, you have more time because we tend to come in about 12 to 14. Girls about 9 to 10 or 11, 12. How old are you now, Ali? 7. You got a couple 3 years there before we start looking at anything like that. Now, during the exam, if we notice a big overjet, an overbite, then we might refer them to a specialist sooner. Or if you have a big crossbite, we had a girl in here earlier today. She had a crossbite. She was, how old was she? About four years old. Good girl. She did great. No cavities, but she had a crossbite. What are we going to do? Nothing for a while. Sometimes that will correct itself over time. It may. Remember I told you the mouth about doubles in size. It could grow out. So when those permanent teeth come in, they come out. We call it to the buccal. So they come out over top of the baby teeth. So that's what we're hoping.
So it's not too bad to go to the dentist, is it?
No.
She's had a lot of experience. She's had teeth taken out. Extractions. She's had fillings. She's had a pulpotomy. Pulpotomy is where you take the nerve tissue out of the tooth. She had a toothache. She had a little abscess with some of the infection, the exudate coming through it. We had to get her on antibiotics, and Mom was a nervous wreck, but she made it through it. So it all worked. She's a great patient.
Yeah. So it's not too bad treating your child then either, right?
No, not too bad. When she acts the way she does, she's good.
Usually moms are more nervous than the kids. And a lot of times, let me kind of say that. A lot of times we will try to separate the mothers from the kids, but sometimes we want them in there. You never exactly know. I never tell a parent they can't come back. Sometimes when we refer to a specialist, they won't allow the parents to come back, and that's fine, because if I can't do it, something happened in that room. So the specialist knows, hey, we better separate Mom early. So I never do that initially unless I get a feeling that, hey, this is going to be better if we get rid of Mom. So sometimes I'll wink at Mom and I'll say, hey, can I get you to sign a paper? We'll get her paper and we'll go in the back and I'll say it'd be better if you can kind of sneak out. Little Susie's kind of a little agitated, so let's kind of calm her down a little bit. Another thing, we use a lot of nitrous oxide, laughing gas. We use that on children. Usually when we do restorative work, which is our fillings, they do very well on that. We get them in early in the morning, usually 8 o'clock in the morning. We have nothing on their stomach, so they don't get sick. We don't want them to aspirate anything, so we always bring it in on an empty stomach, and they do very well. But usually if we use laughing gas, we have to do it in conjunction with local anesthetic, which is that other thing we don't like to talk about, the injection, which is the word I use because we don't use the S word. S word is not what you're thinking. It's shot. We don't say we don't say the S word. Again,
That one vowel makes a difference.
right. That's it goes. Yeah. So and I very rarely say the shot word. We say injection or did you numb them or something like that. So, but moms will say, "Is that pus?" No. She asks if that's pus. Okay. But a lot of moms will use the S word and they'll just say, "Oh my, do you have to give a shot?" And we go, "No, we don't do the shots in here. We give injections." You know, so but that's how we have to play it. All right.
So again, if you have a child and you're looking for a dentist, come to see Dr. Johnny Isaacs here at Isaacs & Isaacs General Dentistry, and the phone number?
859-336-7680. What was that number again? 336-7680.
Look at the camera. 859
330
336
336
7680.
7680.
Very good.
Good job. Well, thank you very much. This has been Gary White for Channel 6, Central Kentucky Television.